presentation on Ballet, an excellent non-pharmacological therapy for alcohol use disorder, which I decided to make for May Mental Health Awareness Month. Why? Because I think that alcohol use disorder is a big problem, and it would be good to think about incorporating ballet dance as a very effective and enjoyable therapy. Why, you would say, I would want to study and treat alcohol use disorder? Because I'm a psychiatrist and scientist, and through my work on dopamine receptors in psychiatry in the clinic, I have encountered the problem and am interested in treating it, even better in preventing it. I myself don't drink at all alcohol, not a sip. I'm like my mom, and this is why I know that life can be very joyful and beautiful, and you can feel all of the range of beautiful emotions without the need for alcohol. And this presentation will touch upon key points, but it will not be exhaustive. And I decided to make it into two parts. I made some slides with figures because figures are excellent for explaining the material, and I will include a link to another video with some nice figures about the brain regions involved in alcohol use disorder and in dancing. And I am going to first highlight the problem of alcohol use disorder, which also has been called alcohol addiction, and then offer some numbers to show its magnitude. Then I will touch upon the brain regions which are involved in alcohol use disorder. Of course, we know that besides the brain, the body is also involved. And for example, the cardiovascular system is involved. There might be hypertension and arrhythmia, and there is muscle wasting, and the pancreas is involved, in the liver, and the immune system, and therefore besides the brain, alcohol affects also noxiously the body. And after I present the brain regions involved in alcohol use disorder, I will touch a little bit upon the neurotransmitters and neuromodulators, all of the substances in the brain that are involved, such as dopamine, one of the most important neurotransmitters. Then I will show you the regions that are involved in dance in the brain. Of course, in dance also, besides the brain, the entire body is involved. And then I will highlight why ballet is an excellent non-pharmacological therapy for alcohol use disorder, with highlighting some changes in the brain and then some psychological benefits. We know that there are treatments for addiction, such as naltrexone for alcohol use disorder, naltrexone, acamprosate, gabapentin, but as I will show you, I think that ballet and dancing are especially effective in preventing the relapse and in achieving long-lasting remission because of all of their positive effects. And so let's get started. I think I will try to make this presentation maximum 15 minutes, and it will be simplified because I like to simplify problems, having in mind what Albert Einstein said, that if you can't explain it to a 6-year-old, you don't understand it yourself. And so first, in order to think about ballet as a non-pharmacological treatment for alcohol use disorder, let's just delve into what is alcohol use disorder. And for this, we can take a look at the NIAAA website, National Institute on Alcohol Abuse and Alcoholism, and there, alcohol use disorder is defined as a medical condition that is characterized by the DSM-5 TR is a problematic pattern of alcohol use leading to clinically significant impairment or distress. And it can be mild or moderate or severe, depending on the number of symptoms a patient has experienced in the past 12 months. And as alcohol use disorder progresses in severity, the alcohol-induced changes in the brain can make it very difficult for a person to cut down on the drinking and to quit. And although brain changes occur, with abstinence some of these brain changes are reversed. And so this is why treatment such as medication and ballet can reverse the noxious brain changes. And for more details about what are the symptoms, I encourage you to look at the NIAAA website and to consult your primary care physician or psychiatrist. And to say that besides the brain, alcohol is very noxious because it causes many diseases. It can cause heart disease, liver disease. It can cause cancer and dementia, and so sleep problems. So it is learning problems, anxiety, depression, and it is a really problem of great magnitude. And my opinion is that women are affected more severely, and it is known that women have less tolerance to alcohol, perhaps because of different reasons. One of them is hormonal reasons, and so especially for women, alcohol is very noxious. And there are several stages of alcohol use disorder which scientists have adopted. One is the binge intoxication stage, where the person feels the positive emotions with drinking and they want to drink more. And this forms a habit. And in this stage, the striatum is involved in the brain. Then the next stage is the withdrawal negative effect stage, This is when the habit has been formed because of the positive reinforcing effects, and when people don't have access to alcohol and drink, they feel anxiety, fear, and so they um, are irritable and they want to drink to alleviate the discomfort and the emotional pain. And it is believed that the amygdala in the brain, which are involved in emotions, are involved in this stage. And the third stage is called the preoccupation and anticipation stage. And here, um, this is a stage where people anticipate and they can't stop themselves from seeking and obtaining alcohol, and it is believed that the prefrontal cortex, which is involved in executive control and in decision making, is involved. And why am I mentioning these regions? Because ballet dancing affects also these regions. The stridum habit forming, the dance routines, then the amygdala, the emotions associated with dancing. Of course, other regions also are involved, such as the thalamus, the other parts of the limbic system, and the prefrontal cortex in decision making. The cortex and the motor cortex are also involved in dancing ballet. And so I touched upon briefly the magnitude of alcohol addiction, but to say that people ages 12 and older, there are about 28.9 million individuals affected. Youth ages 12 to 17, approximately 757,000 young people affected. In adults ages 18 and older, 28.1 million adults affected by alcohol use disorder, from which men are a bit more, 16.6 million, women 11.5 million. And this is from a 2023 national survey on drug use and health. And so I mentioned the regions involved in addiction. Besides that, the cerebellum is involved, which is involved in habit formation and emotional regulation. And an important system in the brain, which is involved in habit formation and movement and reward, is the dopamine system. And the dopamine system is located in the prefrontal cortex and the striatum. Dopamine is produced in the ventral tegmental area, and it has been found that with alcohol use disorder, the dopamine receptors in brain are reduced because of the constant activation, and there is compensatory decrease. However, besides dopamine, there are other substances involved in the brain. For example, oxytocin, which is involved in empathy, affiliative behaviors, head movement, acetylcholine, glutamate, corticotropin releasing factor, and more. And so we went through the brain regions in addiction, and I want to mention something about the brain regions and the changes that occur with alcohol use disorder. So there is pathological learning which occurs in the striatum, and this is neuroplasticity. And the brain regions that are involved in dance largely overlap. And while dancing, this is a physiological way to reset the changes that have taken place with alcohol use disorder. And I will just mention some mechanisms. Ballet may be a physiological reset by enhancing neuroplasticity and engaging the motor circuits in the striatum and emotional centers in the brain to promote functional recovery. And dance, by affecting the striatum, may regulate the reward pathways. It may also stimulate dopamine, and so there won't be any need to drink alcohol to increase the dopamine levels. And some other mechanisms are dancing improves the cardiovascular function, and we know that alcohol use disorder is associated with damage to the cardiovascular system. Of note here then, the therapy with dance should be personalized, and it should be more gentle, not such intense exercises. And dancing ballet improves the functioning of the immune system, which also may be dysregulated in addiction to alcohol. And what are some of the psychological benefits of ballet? It promotes a structured, expressive, and immersive experience that helps individuals regain control over their minds and their bodies. Ballet requires amazing discipline, and people are trained to regulate better their decisions, and they have greater willpower. Ballet cultivates self-regulation, resilience, and purpose, helping individuals replace the compulsive behaviors with mindful movement. It provides sensory and emotional grounding. This is especially important, offering an outlet for emotional expression without words and positive reinforcement. Dancing ballet also involves listening to beautiful music, which has benefits for the mind on its own and helps in the recovery from alcohol use disorder. Ballet boosts confidence and self-worth, helping individuals reconnect with their identity beyond addiction. Ballet makes a person stronger physically and mentally, which will help the brain and the body to fight alcohol use disorder, resist the cravings, and recover better. And ballet reduces stress, and we know that stress is a trigger for mental health disorders and for alcohol use disorder. Ballet improves sleep, which may be disturbed in alcohol use disorder. It creates happiness, and it is a form of reward. And so, ballet, in my view, may be especially useful to achieve long-term abstinence in alcohol use disorder. So I hope that in this video I highlighted why, in my opinion, ballet is a great non-pharmacological treatment for alcohol use disorder. And there are articles in the literature with people recovering using dance. And please click on the link in this video to watch the slides associated with my presentation. I will welcome any questions and comments in the comments below, and if you like my videos for health and happiness in psychiatry, please subscribe to my YouTube channel. Thank you so much for your attention.